When you're considering having a baby, starting a family, you want everything to be perfect. But for women with inflammatory bowel disease, it can be frustrating and confusing trying to figure out exactly how the disease will affect their pregnancy. Well, here to shed some light on the subject is patient advocate Jessica Karen, along with Dr. Uma Mahadevan. Thanks to both of you so much for joining me.
Thanks for having us.
Thank you.
Of course. So, doctor, starting with you, if a woman believes that IBD is going to impact her pregnancy in the future, what steps do you recommend that she take to sort of ease her stress about it and maybe ease the complications that could arise out of it?
Well, it's very important that women realize that they can have pregnancy. Women with inflammatory bowel disease are 3 times more likely to be voluntarily childless, and some of that has to do with the misperception that they cannot conceive. And so once they have a diagnosis and they're interested in having a family, they should have discussions with both their gastroenterologist and their obstetrician to make sure that they understand what their risks are and what they need to do to get ready.
Right. And Jessica, as an IBD patient yourself and also an advocate, run us through some of your thoughts, some of the emotions that you had when it came to starting to plan your family.
Yeah, when I was thinking about getting pregnant and starting my family, I was really concerned about, could I even get pregnant? What would it look like to be pregnant with Crohn's disease? Would it be safe for me, for the baby? And who would help me through all of this? And even where would I go to answer these questions?
Right, and of course, more and more you've found, I'm sure, that there are tools for women going through this. What tools are out there?
Yeah, so back when I was having my children, there weren't a lot of tools available, actually. So I did have to do a lot of researching, but luckily we've really addressed that with the Parenthood Project at ibdparenthoodproject.org. Women can now find tools that can assist them in conversations with their clinician from preconception to pregnancy, to post-conception, and even breastfeeding, as well as a list of common misconceptions and best or latest evidence to address those concerns that women can use to feel empowered in their discussions with their partner, with others, and in their discussions with their clinician to make the best decisions possible.
Well, and even though those are great resources, Doctor, how important is it for women to also partner with their care providers, with their doctors, to make sure they're on the right track?
It's really important, and another part of this project is to provide information for providers to have all the same information and the data. So launching with this is a care pathway that was jointly developed by the American Gastroenterology Association and the Society for Maternal Fetal Medicine. So for the first time ever, we have gastroenterologists, maternal fetal medicine specialists, and patients coming together to put together a care pathway that addresses how these women should be managed prior to conception, during pregnancy, and after pregnancy, so that everybody's on the same page and has the same data. By giving a unified front and a unified birth plan, we can make a more comfortable and healthy pregnancy for women with inflammatory bowel disease.
Well, it's certainly a conversation that doesn't happen often enough, and to bring awareness to it in this way and to start the conversation is really great. And there's a lot of people out there probably listening saying, that's me, and I'm glad that we're having this talk. So thanks so much to both of you for joining me.
Thanks for having us.
Thank you.
Absolutely. Stay where you are. We'll be right back.